Hello, Namaste. My name is Ronen Acharya and I am the participant of Asia Pacific Conference of Young Scientists APCYS 2020, where I have presented about my robot Servo, an assistant robot for hospitals. Actually, Servo is an Arduino-based robot where Arduino UNO is used as a major component that controls each and every activities of the robot. Servo can be used as assistant robot for hospitals during the COVID-19 pandemic. Without any risk, Servo will enable healthcare workers to monitor and tend patients remotely with the help of a remotely operable vehicle. After a month-long research, Servo is made in such a way that it can visit multiple patients at once. Since the pandemic of COVID-19 is increasing day by day and maintaining social distance is the most important agenda, using robots can be a better way to improve quality of care and patient outcome, which has been accepted in the advanced hospitals all over the world. Robots can act as an interference between doctor and patients as well. Similarly, the healthcare workers have been frontline fighters of COVID-19 pandemic since day one. These days, with a very high rate of transmission worldwide, we can see our healthcare workers are at extremely high risk. It is not affordable to lose our frontline fighters during the COVID-19 pandemic. Minimizing their contact with the infected people and ensuring their safety should be our concern of utmost priority. Robot Servo is to be used in hospitals to decrease the physical contact among healthcare workers and COVID-19 infected patients, along with sanitizing the peripherals. Actually, I have got a reaction from Dr. Samrat Koirala, general physician who is doing his internship in Sri Virendra Hospital, Chhaoni, Kathmandu, Nepal, and he says,
I'm Samrat Babu Koirala, an intern doctor at Sri Virendra Hospital, and like everyone else, I've been feeling the pinch of pandemic. But being in medical profession, it stings a little worse. In these moments, to sit back and cower because of COVID-19 seems like a betrayal of medical profession. But to go head first without any protective equipment seems like a betrayal of sanity. So the idea of minimizing the contact between patients and doctors, or any medical profession for that matter, seems less than an idea and the most crucial determining factor in whether you're fighting the virus or transmitting one. So the idea of having robot in medical profession seems like a major step in the right direction. Not only does it decrease the contact between patients and medical professions, thus decreasing transmission, but it also makes sure that we're using PPE only when absolutely necessary, which there is already a major shortage of. I would be thrilled to have Servo in my hospital. Thank you.
Likewise, I do have got a similar type of reaction from Sarita Dami, staff nurse at Gokuleshwar Hospital, Darchula, as she is very appreciated with the working objective of Servo. And she says,
Hello, it's me, Sarita Dhami. I am a staff nurse and recently I am working in Gokuleshwar Hospital, Darchula. Actually, there are many problems regarding this COVID-19. We health workers are facing some of which are lack of PPE, lack of instruments, and risk of transmissions, especially to those who are pregnant and lactating health workers. Social issues affected by who are affected by the disease, they are facing social issues too. Here you are thinking to bring a robot specially for isolation ward. It's really interesting. Yes, these types of trends can reduce transmission among health work provider. Because each and every procedure were done only by getting closer to the patient. But if there is a robot there, it can follow our instruction and can provide best care as a health worker. Each and every works are done by robot, and we can sanitize that robot for reuser purpose too. This can reduce the number of COVID positive cases among health workers. Yes, of course, it's really amazing and interesting. Thank you.
as talked earlier, Arduino UNO and motor cells are the major components used in Servo. HC06 Bluetooth module is used to maintain communication between smartphone and Servo. And all these microcontrollers and motor cells are kept in this section of robot along with 4 200 RPM motors. Similarly, we have infrared camera that helps to capture movement of servo even in the night time. Similarly, we do have a HCSRO4 ultrasonic sensor that helps to measure the distance between robot and bed of patient and sends data to the smartphone's application. We do have an automatic hand sanitizer dispenser that dispenses a regulated amount of sanitizer through it. Similarly, we have a small camera over here, and this camera is used to maintain communication between patient and healthcare workers. Similarly, in the backside of the robot, there is a mechanism, and this mechanism is sprays the disinfectant. Actually, here is filled the disinfectant, and through a pipeline it is supplied to the mechanism, and the mechanism sprays the disinfectant in the peripherals around it. Talking about the control of servo, it can easily be operated with a smartphone by just installing an application in it without any prior training. Actually, there is maintained a Bluetooth connection between servo and mobile phone. It can be operated from a certain controlling area, and the movement can be observed through a camera attached on the bottom of robot. 200-meter radius is enough to run servo smoothly. The main advantage of device can be taken as its price. Actually, servo was made for 3 times with different materials and finalized an appropriate model. Different results were recorded while making servo in 3 different times with different materials, and later finalized an appropriate model that can even be used in a practical life as well. I would like to express my utmost gratitude toward my mentors, Engineer Acharya and Engineer Mohan Nepali, whose sincerity, guidance and encouragement has been an inspiration for me since the day of conceptualization to prototype. I would also like to express my gratitude toward the member of Nepal Collier Institute, my school, friends and families for their kind encouragement throughout the development of a robot and opportunity to obfuscate. Similarly, I am very much glad toward the entire organizing community of Asia Pacific Conference of Young Scientists for providing such a great platform, and not only taking an interest in the helping new technologies, but also encouraging young talent like me to pursue my career in the field of science and technology. Thank you. Have a great time.